Good afternoon. On this topic, our main objectives were to review the spectrum of pathology and the operative results in the mitral valve endocarditis with respect to native versus prosthetic endocarditis, causative organisms, and invasiveness. Thank you. From January of 2002 to December 2010, we had 475 patients who underwent operation for mitral valve endocarditis. Out of these, 64% had isolated mitral valve endocarditis. Out of these patients, more than a third were either in NYHA class 3 or 4. More than one-third had previous history of stroke, CVA, TIAs, and about 40% were actually reoperations. So first we look at native versus prosthetic. Out of these 475 patients, nearly about 80% patient had NVE, and rest of them had prosthetic valve endocarditis. When we look at the operative, what was done for them, we were able to repair actually more than half of these patients with a native valve endocarditis. Obviously, with all the prosthetic valve patient underwent another valve operation, valve. In terms of overall hospital death, our in-hospital death for the whole native and prosthetic combined was about 7%. The hospital death rate for a native was 6% and 9% for the prosthetic valve endocarditis. Although when you look at the p-value, it was not very different. But patients who had prosthetic valve endocarditis did have a higher rate of intra-aortic balloon pump insertion postoperatively and higher incidence of a kidney failure. When we look at the long-term survival between native and prosthetic, there was not much a difference between these two groups. So what we've been able to achieve is that over time, what we see is the difference between native and prosthetic valve endocarditis is not much different if we operate them on time. Then we looked at the organisms involved. Staph aureus, viridans, and Staph epidermidis and enterococcus. These were the predominant organisms which were responsible for about 70% of this case of all these infections. And then we try to look at how they did in terms of different bugs. And in terms of in patients who had native valve endocarditis, strep had the best long-term results, while Staph aureus and Staph epidermidis had the worst results. Now, it was very interesting to look at the patients who had prosthetic valve endocarditis. In them, the patient who had a strep infection, actually, viridans, initially they seemed to did well, but in the long term, they seemed to have the worst result, along with Staph aureus. This was very interesting, we found. So what we understand is that the long-term results varies with organisms, and the long-term results seem to be better in patients who had a strep infection, viridans infection, and who had a native valve endocarditis. Now, next we look at disease which were going beyond the annulus, or which were basically beyond the leaflets. And we found that more of the higher percentage of patients who had prosthetic valve endocarditis had invasive disease. Now, we then try to differentiate between these two groups of patients in terms of native and prosthetic. And what we found is, in patients who had a native valve endocarditis, the predominant organisms, as we saw earlier, was staph group and strep group were the predominant. When we come to invasive endocarditis group, staph group, basically Staph aureus and Staph epidermidis were the predominant organisms. Then we look at these two groups in terms of non-invasive and invasive. And what we found was that in both of these groups, this is invasive and this is non-invasive, the best results were with the strep group, and worst results were present with Staph aureus infection. And then we looked at our overall result. This, I think, is very important to finding which you have is, overall, we look at the whole of these mitral group patients. The non-invasive group did much better than the patient who had invasive disease. So overall, we look at the whole thing. we can see that long-term survival is worse with disease which is invasive and non-virulent infection. Then, so if we can summarize the whole thing, survival varies with invasive disease and organisms. There's an interplay between the prosthetic valve endocarditis, organisms, and invasiveness, which requires further studies. Low incidence, low operative mortality, good prospect of repair in native valve endocarditis, and worse prognosis associated with invasive disease makes it say again the same point that early operation is definitely going to have a better results. Thank you.